Hello everyone, my name is Aksh Patel and welcome to Black Screen. Today we'll be looking one of the important topics in PSM, and that is contraceptive methods. This is a very simple topic, yet it is annoying and quite monotonous because it is very lengthy. So today I'll try to cover this whole topic, this contraceptive method, into one whole chart. You can see the whole chart which I've prepared. This is quite easy yet lengthy. Okay, so without wasting the time, let us start. So contraceptive methods are basically divided into two methods. One is temporary method and the other one is permanent method. Permanent method is quite easy, which includes tubectomy and vasectomy. Tubectomy means occlusion or cutting of fallopian tubes, and vasectomy means occlusion or cutting of vas deferens. That is the permanent method. Now, this temporary method is quite complex and it is further divided into many subheadings. And they are barrier method, IUCD, hormonal, post-conceptional or post-coital, and we have miscellaneous. So, temporary method is divided into five further sub methods, and they are barrier method, IUCDs, hormonal, post-conceptional, or miscellaneous. You can remember this as Beam P. There was a cartoon named Chota Beam, and it was coming on Pogo channel. So you can remember that as Beam P, barrier, hormonal, IUCD, miscellaneous, and PO, Pogo. Okay, so five sub methods. Let us quickly look into each of this method. We have first barrier method. A barrier method is further divided into three methods, and they are physical barrier method, chemical barrier method, and combined barrier method. Physical barrier method consists of condoms, diaphragms, cervical cap, vault, etc. Chemical methods include foams, jellies, creams, suppositories. So all these chemical methods are actually spermicides, which kills sperms. Okay, and combined method includes the combination of physical plus chemical. So using any one from this, and in addition to that we use any one from chemical method. So that is the combined method, physical plus chemical. Okay, so barrier method is done. Now we move to the IUCD. So let us trace this yellow line, and it includes three further methods. Like, these are not the methods, but IUCDs are divided into generations. We have first generation, that is very old, followed by second generation, and third generation is quite latest. So first generation includes Lippis loop, second generation includes copper T, and third generation includes medicated T, means copper T in addition to some kind of medications. Medication include progesterone. So this is copper T plus progesterone. Progesterone, we consider that as medicated. Okay. You might be thinking what IUDs are. So IUD is intrauterine devices. So these are the devices that are placed inside the uterus that bring some biological changes which prevents pregnancy. Okay, so we are done with barrier method, we are done with IUCDs. Now let us move to hormonal methods. Hormonal method, let us trace this pink line. Okay, so hormonal methods are further subdivided into four methods, and they are oral, injectable, implant, and vaginal rings. Let us first discuss this oral method. Let us trace this yellow line, and we have two methods under oral method. So one is combined preparation and the other one is single preparation. So oral tablets are like they are available as combined preparations or single preparation. Combined means combination of something. So uh, it includes monophasic and it includes triphasic. So what this combined preparation mean actually? So it is the combination of progesterone plus estrogen. So that is combined preparation. And in single preparation, we see it is the estrogen pill or progesterone pill. So progesterone pill is also known as mini pill. So single preparation includes either estrogen or either progesterone. Okay, so these are the single preparation, and in combined preparation we have estrogen plus progesterone, both. Now, what is monophasic or triphasic? So monophasic consists of the dose of estrogen and progesterone is constant. Like for example, uh, we have 30 microgram of estrogen and 500 microgram of progesterone. So this remains constant. Okay, so that is monophasic. And in triphasic, what we have is uh, the dosage of estrogen and progesterone keeps changing. So whole menstrual cycle is divided into three phases, and in each phase the dosage of estrogen and progesterone keeps on changing. So that is the triphasic. Okay, so monophasic is again divided into two pills, and that is Mala D pill and Mala N. Now, what is the difference between Mala D and Mala N? So Mala D consists of low dosage, and Mala N is a standard dosage. That's it. If I talk about the dose of each estrogen and progesterone in Mala D as well as Mala N, then we have in Mala D, estrogen is 30 microgram and progesterone is 500 microgram. And in Mala N, and that is the standard dose, we have estrogen as 50 microgram and progesterone remains the same, 500. So this can be asked in the NEET. You have to remember this dosage. For triphasic, you don't have to remember any dose. Okay, so you can remember this as 30-50. So estrogen is constant. Sorry, estrogen keeps on changing. In Mala D we have 30 and in Mala N we have 50, and in progesterone it is just the same. Okay, so uh, we have completed with hormonal. No, I guess injectables are left. So we are done with oral, combined, single. Combined is again divided into monophasic and triphasic, and single is divided into estrogen pill or progesterone pill. So estrogen pill is also known as mini pill. Sorry, progesterone pill is also known as mini pill. Okay. Now we have second sub method under hormonal method, and that is injectables. Injectables means injections. So we have two injections available. One is depot medroxyprogesterone acetate. We remember it as DMPA, and the second one is norethistérone enanthate. We remember it as NETEN. Uh, this DMPA lasts for 3 years, and this lasts for 2 years. Okay, so DMPA lasts for 3 years and NETEN lasts for 2 years. Third method under hormonal method is implants. Implants means you implant something under your skin, and the name of that implant is Norplant, and Norplant consists of levonorgestrel. That is a form of progesterone. Okay, vaginal ring, you don't have to remember anything because it's not given much in Suryakantha or Park. You just have to remember vaginal rings as it are like they are the rings which are kept inside the uh, vagina that constantly releases same levonorgestrel. Okay, so we are done with hormonal methods. We are done with barrier method, IUDS, and we are done with hormonal method. Then we have post-conceptional method, that is after conception has taken place. Uh, so there are many methods, but what I have written over here, these are the emergency methods. Emergency methods. So emergency methods include 5 sub methods, and they are high dose progesterone, we call it by its nickname I pill. Then we have high dose estrogen. Then we have estrogen plus progesterone combined, and that is the USP method. Okay. Then we have danazol and mifepristone. So both these are newer methods. Both these are newer methods. Okay. So as an emergency, emergency means there is failure of contraception, or if there is rape or anything. So in that case, we can use any of these methods. The most efficient is mifepristone and USP method. So this USP method has to be given within 72 hours. Okay. Then we have miscellaneous method. Let us trace this pink line. Uh, so here are some of the miscellaneous methods. So we have abstinence. What is abstinence? Means not doing intercourse during the fertile period. Okay. Then the second one is coitus interruptus. Coitus interruptus is also known as withdrawal method, in which male withdraws its genital organ before the climax. The third one is lactational amenorrhea. So this is a natural method in which there is no ovulation in the first 6 months after delivery. The fourth method is non-hormonal long-acting oral pills. You can remember it as Saheli pill. So Saheli pill is once a week pill. So you just have to take 1 day in a whole week, and that will work for you. Then we have birth control vaccines. So these are not available commercially, but research is going on. There are three types of birth control vaccines. They are Zona vaccines. Another one is anti-HCG vaccine, and third one is anti-sperm vaccine. But you don't have to remember this, because these are not commercially available and research is still going on. Okay, so let me rub this. Okay, so we are done with temporary methods as well as permanent methods. You can see the whole chart. You can download the PDF from the description below, or you can join my Telegram channel, that is Black Screen. There you'll find this whole chart. In fact, this is a very easy and you can prepare it on your own. But if you want a ready-made form, then you can download it from the description. Okay, thank you.